Hi, Dr. Swapnil. Hello, how are you? Are you still
Fine.
in this earth? Still, flying high, and we need a parachute to get down.
No, sir. No.
Has
I'm,
sunk still inside.
sir, finally it has settled. Gradually it will settle down. It will remain for 2, 3 days, I guess. Because it is one of the rarest. No one has even dreamt of getting a rank one in AIMS and even in common PGI as well.
Great. Guys, I have a great news for all of you. We have with us Dr. Swapnil Chaudhary, who has scored the current session rank 1 in AML and also the common merit list rank 1 in medical gastroenterology. It is simply an amazing feat. There is no, nothing else can be told about what Dr. Swapnil Chaudhary has achieved. It is a dream of everybody to get into the top institutes of the country, and one of the most competitive exam that we face from a super specialty perspective is INESS. And here is a man, Dr. Swapnil, who has cracked it and is standing on top of Mount Everest right now. So straightly let's go to him. Dr. Swapnil, how did you feel the moment you checked the rank? Like one means I would have double checked it two, three times. Is it 1 or 10 or 20, 30? How did
Sir,
you feel
I
that?
was not
Please.
I was not expecting it. First of all, ki it will come so early. I was outside with my friends and enjoying. We are out of station as a team. We are came together to play a tournament of a cricket, sir, uh,
Oh,
in
cricket
Andhra
fan.
Pradesh. Organized, yes.
Andhra. Yeah.
And we were enjoying after yesterday, and we were sitting. Then one of my senior told that result has come. What is your result? And all of us were sitting, and I saw my result first of all, I checked. I was very happy. I was not able to believe. I was not able to breathe for 2 minutes exactly. Then I rushed
Two,
outside the
two
room. Then
minutes
I
of
saw it
apnea.
twice, sir. Sir, I went outside and checked it once more, sir. Then I called my parents and told them. They were also very happy.
Great news. So 2 minutes of apnea followed by realization. So seeing one should have. It's like I don't know how many people get this luck of seeing a single digit and a single topmost rank. So, anyways, it's a really amazing rank that you have got.
Thank
How
you, sir.
did you like? First of all, please tell us about yourself. I personally know about you because we've been in constant touch through WhatsApp. But then, of course, please introduce yourself to the entire colleagues and friends, whoever are watching this video.
Sir, I live in Rajpura, a small town near Patiala, sir. I did my MBBS from SMS Medical College, Jaipur, and then after that I did my MD from PGI Chandigarh, sir. 6 months ago I passed.
Okay. So you have passed from premier institutes like PGI Chandigarh. So how did you feel that an institute of that magnitude changed your approach towards medicine, or what did you feel is the speciality with these institutes?
Sir, their entire MD training program is quite different from the regular state college in other colleges because here most of the things are mostly focused on super specialty because most of the cases are handled by super specialty teams only, sir. Uh, During our MD training program also, we were posted in various departments for about 2 to 3 months, sir. Almost every department we had to do a work for 2 to 3 months, sir. So we got
Okay.
exposure to such super specialty courses, sir, that that helped us and amazed us. Ki just not medicine is just not about making diagnosis. We've seen the various different treatment options, sir. That likely amazed us and most of us, and then we prepared accordingly.
Great. So the learning point from you is uh, you're from a really good institute to tell others how the MD course in your particular college is. So, a student gets posted for 2 to 3 months in almost all the possible super specialty branches, which in itself puts the seed of curiosity and interest in a particular branch. It's like a conscious informed decision before getting into a branch in the future, which really plays an important role. Because I'll tell you, I know enough of my colleagues, seniors and juniors who, because of various reasons during their MD days or DNB days, hadn't got exposed to all the kind of possible departments that could be a potential super specialty department, could not narrow down into a specific department. Then, because their colleagues are taking something, they show a pseudo interest towards something, take a seat, work there for some time, then realize it's not up to their taste, change it to one more branch. And I have seen one of a few of them have even changed 2 to 3 branches before narrowing down to a single branch. In that way, if you do from an MD or DNB from a place where you get exposed to many super specialty branches, it will give you a taste of what could be your food for future. So what I'm trying to tell is this kind of exposure is really important. That will help you to make the decision quite early, and it's quite conscious decision, isn't it? That's great.
Yes, sir.
So why gastro? You have got exposed to so many branches. So obviously you would have had many branches. So many, some branches are completely OPD based, just patient. Some are completely intervention based. Some are like, why gastro?
So I don't know the real reason, but I uh, myself only I got interest in gastro. I was posted in the first posting was gastro only when I joined MD. For 2 months, that was very toxic. Most heavy posting in PJ is gastro only, sir.
Toxic.
Then, sir, for first year it is toxic because the workload is very heavy. For the first
Yes.
year, especially, sir. when
Hmm.
when you have just joined and every most of the friends are getting in easy or some other posting and you're getting a guest room where you have to do most of the sampling and all stuff, sir, in PGI.
I agree.
Then, sir, then first posting, but at that time I just joined. I was just amazed to see the people doing. But most of the interest came when I was posted in second year in Gastro for 2 months, where we used to we were involved in patient care as well as we were used to assist in ERCPs, endoscopies, and EUS. Also, we used to assist the professor, sir, writing reports like he used to
This
dictate and we
at
used to
least
read
got
that.
an idea. See, many times for the students, when I'm explaining to them, they would not know anything. So they're having an idea during your MD into helping them making the reports, them showing you some pictures. See, this is interesting. See, this is a procedure where patient has blood. See the blood. We are going to band it. This is the procedure. Along with technician, you also assist us. Wear your gloves and come. This will really, get that thing inside you, isn't it?
Yes, sir. So that was the main prime motivation to after that. But I was not sure at that time also. I was mostly sure that I will take an intervention branch and mostly gastro because it was I was posted for 2 months. But after that, gradually it narrowed down ki this is the I want to pursue gastroenterology. Then, but sir, I had not specifically studied at that time or even read any book because I was like after MD I need a break. I will take a break for 6 months and then I will do for prepare for the super specialty, sir.
Okay, good. So when was the point you actually started? See, you have realized that gastro is your interest. When did you start? Yes, this is the time I want to start off. Like, when did that happen?
Sir, as most of the postings are active, we did not got any much time to study during the after about 2.5 years, last 6 months when we prepared for our most MD exams also. That is the time when I got a bit relatively free postings. Then I started. First of all, I started with gastro only. I saw videos. Then I did my as well as my MD course for medicine, but I just saw the videos and video stuff at that time and prepared notes because mostly printed notes. I prepared the notes also. Then, but during that at that time, during the preparation for the MD exams only I prepared, but were not oriented for the entrance exam at that time, sir. It was like if I get a rank, that's okay, but I was not fully prepared for that, sir.
Okay,
Then
second.
after the MD, I took a break and then prepared for it.
Were you very sure that you want only NSS, or you were also parallelly preparing for NEET SS also? Like some of the students
Sir,
try to balance between both. Some of them, top rankers especially, tell that, sir, NESS I was concentrating from before. Some of them prepare for NESS parallelly for NEET SS. I don't know. They juggle between both. Like, what did you feel is best?
sir, when my MD, I got my MD completed on July when I came back home. Then I had approx need for 2 to 3 months. I first of all started. I was mostly oriented for INI only, sir.
Okay.
ठीक है, but I started my preparation for with the Gastro only. I did again saw this. First of all, I opened Sledginger, and then went through all the notes, did my question bank. I had not done question bank previously. I did my question bank and so saw the new updated videos as well. Completed once I completed all the notes. Then, sir, 1 month to NEET, I thought that I'll revise my medicine notes that I studied during my MD exams also. Then I went through all the notes and did some question banks. Sir. I have not done full question bank for NEET. Just mostly Gastro I was concentrating, but had to go for NEET just to for a security purpose if I don't get a rank for it. Uh, I got a rank of 300, some 330 in NEET. Sir.
Okay. Okay. Not
I was a
bad.
bit
There also.
disappointed on that day only, but I was disappointed there but I knew that I want to go for AIMS and PG. There was 1 month for the preparation. I did my preparation for the INI.
Okay. Now tell me about this 1 month. What did you do? How did you think? Like, how did you systematically divide that 1 month? By what time did you complete the syllabus? Did you even aim at syllabus, or was it more like comprehensive learning?
So mostly with the during NEET, there was not much time between NEET and INI as because 20 days were only there. Before that, I had during the NEET preparation only I had done two readings of my notes and I had done my question bank. I was giving test on it, but I had not given any specific gastro test. Last 1 month I gave gastro full-fledged gastro. I started giving tests for gastro based test. All the previous year the test series 4 test and then this test series also.
Okay.
And mostly I revise my notes and nothing as per specifics. Sir, I'm not that good planner but just I go by day only. Nothing as sort specific I did.
Okay. Fine. You had MCQs. You were good at it. You got the rank. Excellent. How about interview? Like, how did you go about the interview perspective?
Sir, interview I attended your class. That was very important good class, sir. You shortlined all the topics. Then I went through them for about last 2 days. I went through all the most important topics and even talked to my seniors. Most important, they also guided me about the most important topics they're most likely to be asked, and I just revised those parts. Mostly they were covered in our notes only, but I just went through them once more to be more sure.
Okay, good. So, when they asked you questions, how was the moment that time? This is your first interview. It's not like you had given it before, right? In at least this
Yes,
phase,
sir.
in ESS, yeah.
Yes, sir. No,
The
no, sir.
first attempt. How did you feel? Like, how were the questions from the seniors? What kind of questions did they ask? Did they ask really tough question or basic approach based, or just Lessinger was it enough? Or did you feel that you definitely had experience or some practicality, seeing a case somewhere or listening to some videos? What do you feel like really mattered during interview?
Sir, during interview, mostly we are already nervous, but exactly did not ask at most hard question. They usually ask the approach part. They mostly focus on approach. They gave a small history of an patient and just start what other questions you will ask. Take other history you will take. Then they will give other hint. Then they will ask what are the next line of management. Will you do this procedure or you will not do this procedure? Then they'll ask some brief details about, like I got a case of alcoholic hepatitis, sir. Then they asked me what are your differentials. Then they asked me, will you do a liver biopsy? What will the findings of liver biopsy? Then asked me about the prognosis. They were just like they were giving the hints, and you have to just go through that. Then they asked me about the prognostic scores. Then how you will treat. what will be the dosage of prednisolone. Then other two parts was spotter, sir. They asked like two spotters were given a question. You have to tell the diagnosis and the treatment options. Like got a case of eclesia cardia, sir, and
Okay.
other case I got a case of Bear-Off syndrome.
Warehouse
Two
syndrome.
spotters
Okay.
and one. It was about around lasted around 15 minutes. After the interview, I was a bit disappointed, sir, because I thought that I could have done a much better. But that day I was feeling bad, but next day I thought nothing is in my hand, so I left it. I was not sure
Philosophy.
exactly.
Yes.
I was I was really not sure exactly what will I do, because I did not get NEET rank. I did not want to join also. So I thought that I will prepare next time again
Okay.
if I did not get the rank. But by God's grace, I got it, sir.
Great. Great, Dr. Swapnil Chaudhary. Your story is also fantastic. One among the beautiful stories of all the students, that every story is unique, something to learn from. So, you clearly gave a perspective of doing MD from an institute where students get exposure to different branches, the advantage of it, then narrowing it down. Some narrow it down early, some narrow down later. It still doesn't matter. Once you narrow down a branch, you also prepare for NEET SS as a security and still had the vision of NESS, and then prepared accordingly in the 1 month. Didn't have major plans, was not like really systematic. This later, that later, this. Yes, what comes on my way, let me read it. You gave it.
Yes, sir.
Interview, you were there. I still remember a few of the questions that we all discussed. And yeah, now really happy to see you with this amazing feat. Really happy that we were all somewhere in your achievement. We were also a part of it. So this gives us a huge happiness inside us also. So please keep in touch with us. We will be happy and privileged to be in touch with you all. Definitely, as a gastroenterologist, definitely will meet
Yes,
you
sir.
in some of the other conferences in future. So we'll all catch up someday physically also.
Yes, sir.
Welcome to the club.
Thank you, sir. Sir, I want
Okay,
to thank all my teachers at PJ as well as my parents also, who supported me, as my brother who supported me during this preparation time, and all my teachers at PJ, sir. I'm thankful to them. They have shown me the way and to do how to do the things, sir. And even my seniors, sir, all my senior residents who used to motivate me to go for it.
great. So fantastic news. So all the things have conspired you to get this rank in front of you now. Enjoy, party, meet all your friends. Once you get into the rigorous course, again, it's back to pavilion. You have to start from basics, what work, everything. It's like I can go through what happened to us
Still
in
one,
first year. It's okay. Time will pass.
yes,
Yes. So
still 1 month to go. I can enjoy this
yeah,
program.
enjoy it. Enjoy it like no other month. Okay. Take care.
Yes, sir.
Thank you,
Thank you,
Dr.
sir.
Swapnil. Thank you. Bye bye.